All right, so we're gonna start with just a quick warm up. You can use everything we've learned so far with the long strokes and incorporating the lower leg. And I think in the interest of time, that's all I'm gonna do for the lower leg today. Sorry, Gio.
You might need.
When you get too much lotion, massage therapists do this all the time. You might need some for later. You can save some. All right, so you want to do your regular warm-up techniques, and going all the way, including the lower leg, is really nice, as you know. But just for the interest of time, I'm gonna get into the more specific work right away. While we set up the camera, I was already doing some warm-up. So I'm going to start with the most traditional reflexology technique, but the descriptions in today's handout are kind of long, and so I'm just going to verbally describe it myself. The traditional technique is called thumb walking, where you bend the distal phalange of your thumb, in other words, the end of your thumb, and as you bend it, you're pressing in. And then when you release it, you're not really coming up all the way, but you just move forward millimeters or centimeters, and then you press in again. And you walk through in a very organized manner, like you're, vacuuming or mowing the lawn. You want to go in lines across the zones with little tiny pressing movements. Now you can go across, you can go up and down, you can even go on angles, but you don't want to jump around, and you don't want to take big steps between what you're doing. As far as what the other hand is doing, it's on the foot, either helping support the work, which sometimes you can do by pulling the toes back and making a more firm backdrop. Sometimes you can do that by being on top of the foot. And even if you find a spot that feels like it needs extra attention, maybe it feels tight, you can actually use that other hand to pull into your work. So this hand also, you can switch hands. So it just depends on which zones you're working, like what angle is best. Sometimes you're going to want to pull the foot back with your other hand to work through the zones. Now, I very, very rarely actually do the movement of thumb walking because I don't want to hurt my joints. And so you can get the same movement by supporting your thumb and then pressing and releasing. So you're getting the same effect for the client, but these joints are all in a straight-ish line, and the pressure is coming from my body and my shoulder and my hips, and not from this little tiny joint, right? Little tiny muscle, little tiny joint. So supporting, we're getting the same technique, and we just walk through really methodically to do that. Now, variations on the same thing, you can use a knuckle or this part of your knuckle, or if somebody wants it really deep, sometimes I'll even use my elbow. And then I release, and then I press. How's that pressure? If 1 to 10, 7's perfect, 10's 4. 4 is too, okay, 4.
He said that so confidently.
He's like, I already know.
I know my body.
And then how about now?
That's about 6.5.
All right.
Yeah, he could take a lot. I almost pushed him off the table last time.
Yeah, you
And
gotta
he
use
was
more.
still like, oh.
And
more
then
hips.
now.
That's a 7.
All right.
Thank you.
You got it. And notice when it was close, like 6.5, I just rotated my arm to get a different part of my elbow into the point. Now that was just an example. I haven't started really walking through methodically yet. Here's another variation where if you use your knuckle or this part of your knuckle, you can also rotate at your elbow to get into the points that way. So play around with different parts of your hand or just support your thumb and make sure that the foot is stable as you're doing that. So let's show this on a meridian or on a zone. This one happens to be a meridian, which is why I use that term. The spine reflex is the spleen meridian. You can go down or up, change your angle, see what works. It goes all the way up here on the toe. So the toe, you want to make sure you're really supported and see how pinpointed the work is. It's like little tiny steps. If you don't want to miss spots like where the angles go in, so you can even do the same thing with your fingers where it's a real small space. You don't need as much pressure in those real delicate spots. And if you, for your angle, you can also put your fingers together to be stronger and move the foot as you need it. And I could definitely sit down, change my angle, see what is a good angle for me to work. Now, where exactly is this on the line, just to be clear? Whatever shades of skin people have, there's like a difference between one side is lighter and one side is darker. We want to be right along that line and in the tissue. So you'll feel where it's bony and you'll feel where it's real hard and tendony. You want to be kind of right in that tissue area. Questions so far? So I'm just going to keep walking real slow, real methodically. And I feel we're coming to kind of a bottleneck here. Feels tighter.
Yeah.
Those areas are usually sore. So I'll just take a nice deep breath. And if you lose a good angle, you can definitely move yourself.
When you feel a tight point, you obviously stop on it. Are you like methodically pressing into it, or are you just holding it with firm pressure?
Great question. You basically want to be at the client's 7, and sometimes when you get to a tender area, that is actually backing off, and sometimes it's staying where you were. So if you kind of really know the client well, you can kind of gauge, otherwise just check in. Yeah, sometimes you kind of need to ease off a little bit to help them relax into it. All right, and I'm just gonna change, sorry, our camera's trying to keep up with me. All right, I want to get a better angle at this tight spot. And I'm using my hand to get his foot and leg and knee nice and stable. Go ahead and take some nice deep breaths. Beautiful, great work. And how's that pressure? Would you prefer more or less? Or?
More. I'd say it's probably a 4. That's 5, 6. That's 7. Actually.
Now, I tend to ease in first to learn the client's pressure. And yesterday when I work with this client, we got up to the 8 some. So I'm starting a little more cautiously, trying to not get up to the 8. And now I'm going to press through this slide and press into that. Keep working out this tight spot. Yeah, it's getting better, but it's still there. All right. And it's getting better. It's still there a little bit. So I'm gonna slide through it now. This is another technique to push and slide. Now, to support my thumb even more, I might really use my hands together, but I'm keeping my hand off just so you can see better. All right, and then another trick is to pull the foot into the spot. So I like to use my flat knuckles in this area a lot. I can be nice and strong, so I'm going to slide through with my flat knuckles. All right, then I'm going to continue the thumb walking. And again, I'm supporting, not really using my distal phalanges. Now, I would keep going in the same direction. The camera's not showing what I'm doing, so I'm just going to switch. I'm going to move up just so you can see what I'm doing. It's okay to go partially up and partially down. And there's some kind of tension right here. You can literally ask the client to take a nice deep breath, or oftentimes just if you take a nice deep breath, the client will breathe into it. I personally do more just breathing myself. I don't give my clients as many cues, but many massage therapists do give the clients cues, and that works really well also. And then we're going to continue walking. And then the area that had a little bit more stagnation, I'm going to press through it. More in that area, more tightness than crunchies, but there's like really deep, there's some crunchies in that area. All right, so that's an example of one zone using modified thumb walking. I'm not going to show you every single zone, but I want to show you some variations on techniques and also just kind of how you actually approach it if you come to a tight spot or a crunchy or a tender spot. And then notice I work my way through. All right, so another technique is called the press and hook. So you're getting into a tight spot, pressing into it, and then pulling the tissue to the side. Now, I lifted off the foot to exaggerate what I'm doing, but you're staying engaged with the tissue and pulling to the side. Again, your other hand is being supportive. You can use it to move the foot in a direction that works better for you. Don't be shy about it if you need to use more of your body weight to get the foot where you need it.
When you're doing the hook part and you're pulling to the side, does it matter if it's medial or lateral?
Great question. I tend to go, like if I'm close to an edge, I tend to go to that edge. So like here, we're in the shoulder zone and there's this, metatarsal, right? So there's the physical muscles and fascia all in this area that we're kind of really opening up. So we want to kind of go with, how the anatomy of the foot works. And there's definitely something in there. So I'm going to get in there and pull it out. And I can feel like a thickening and crunchies, and it might be tender. Now, if you're not pressing hard enough and you ask somebody, if it's tender, you just might not be pressing hard enough for them to feel it, right? So, they only notice that at a good pressure level for them. But I'm working through the layers there. And I don't use that one much because you can see my thumb is bent when I do that. But I kind of save my thumb work for like certain areas on the feet and neck. I'm using the fingers to really grab around the foot So I'm not using as much pressure on the dorsal top, but I'm using it for support as I can pull aside. And then again, you can work through the areas with a sliding technique. Mix in your other techniques anytime you need to kind of warm up and integrate what you're doing. The next technique is very similar. It's just circles. So instead of pressing and hooking to the side, you're pressing and circling. And again, you can use any tool. You can use this part of your knuckle, this part of your knuckle. You could even use a thumb, but I try not to overuse my thumb. If I use my thumb, I would use it supported. And again, if I need to get really deep, sometimes I will even use my elbow. And I'll try to get out of the way of that. So let's do it up here. Supported thumb. I feel a tight spot right here. Again, you can bring the foot into the work.
So when you're doing that, your fingertip is not sliding across the skin, you're just kind of like rotating within the spot.
Exactly. And I just kind of shifted into a different modification of this one where you're on the spot and you rotate the whole foot with it. But I'm not just doing range of motion. I'm really getting into the tight tissue here. So kind of working the foot into it. And how's the pressure going for you?
Well, that's perfect right there.
All right. So as I continue the rotations, I mean, I'm definitely continuing to feel what's going on in there and continuing to open it up. So it's kind of hard to see visually, but I'm really in the tight spot of that tissue and really opening it up.
No, I kind of can see it like working up through his knee, unless that's just you moving him.
Oh, yeah, yeah, nice, nice. Nice continuation of that one because we're doing opening is to open the whole bottom of the foot. And there are definitely crunchies happening with that.
I feel it.
Will you let me know if anything's too much?
Well, I will.
All right, excellent. And then again, I like to do sliding and squeezing and all that other stuff between those very specific techniques. So if you found a tight spot after you either circle it or press and hook, then you can slide through it. I'm going to show you just a couple areas that are just a little different. The toes, some of you started working with the toes already. Basically, they just need a little more support and precision. So you can support them in various ways. Some reflexologists will like really grab onto the big toe, but you want to be careful. Some people are sensitive with their toes. People generally like their toes to flex or go forward, but the backward extension direction can be hard for people. So make sure it's more supported and not, you know, just kind of pulling it back too far. So, but I got a nice firm support on it now. And I'm going to be just doing very precise increments. You can kind of see by the blanching of his skin, you know, the way it kind of gets lighter when I press through it, that how we're kind of moving the blood in the area. It's, oh, and there's a spot. You wouldn't think it moving in such tiny, tiny areas on the toes, but you will find if you're real precise with it, little areas that need extra attention. And so again, you can do your circles or your press and hook and then work your way through again. But notice how supported the toe is. You don't want to be like pressing it like a lever. You're not going to get very good. And so with those little precise areas, you can even go on the inside or medial or lateral aspects of the toes. And I'm going to show you just one other toe, that how you want to support this part of the toe. If you press in there, be more gentle. and you can be a little more firm with the toe tip. Here's another nice little variation where if you support on the dorsal and the plantar surface of the foot, you can roll through the tips of the toes. And I'm actually feeling crunchies here.
It feels good.
We've got meridians or zones that start or end. So it really opens up. And in reflexology, we've got head, sinuses in these areas. Sometimes you have to change hands. So I changed hands for that. Couple other tips. Your work will just feel more supported oftentimes if your hands work together. So as you're supporting the toes, oftentimes you can support this working hand with your thumb so that you're just working your hands together. It can feel more precise and grounded, and you can just be more skilled with your hands. Sometimes if you're kind of in the air, it kind of feels less controlled and more flopping around. Does that feel different to you, Gio?
A little bit.
A little bit? All right. You can see the difference. All right, so again, these other areas, just as a reminder, whether you are supporting your thumb or using a knuckle, you're just going to cross them very precisely. So little presses, little movements, little presses, little movements, and you'll notice the topography under your thumb is changing, not just with when you're on a more bony versus more muscular, but also when you're on a tighter or looser spot. And whenever you're on a bad angle, move yourself around or it's okay to switch hands. And then it's okay, like a lot of times people will go across in one direction and then come back for the next stripe in the other direction and so on. Or you can work all in one way first and then all the other way next. How much you work through these zones also partially depends like how much of your massage you have focus on the feet. I'll definitely have some clients who request focus on the feet, and then other folks who want a full body in 60 or 90 minutes, and then you're kind of just incorporating the feet. And there's a little crunchy spot there. All right, can we pause the recording?